Good morning. We're here at the Lewis and Clark branch of the St. Louis County Library to announce the latest partnership between St. Louis County and the library system in our response to the pandemic. This week, the library and the Department of Public Health will begin offering a regular COVID-19 vaccine clinic at our 4 library branches, lasting through the end of 2021, including this branch here at the Lewis and Clark Library. Advanced vaccines at each of these branches will be offered weekly and on a consistent day and time. Health insurance and proof of residency is not required. Since the St. Louis County Library began hosting vaccine events in May, over 775 vaccinations have been administered at our library branches. Prior to this, vaccine events were held periodically throughout all the branches in the county. The new schedule provides a reliable and consistent day and time when vaccines are available, making it easier for people to get a vaccine while they're visiting the library. The St. Louis County Library Vaccine Clinic schedule is as follows. Wednesday, starting this week, at the Lewis and Clark branch, 9909 Lewis and Clark Boulevard, shots will be given from 1 to 7 p.m. On Thursday, from 1 p.m. to 7 p.m., vaccinations will be available at the Natural Bridge branch, 7606 Natural Bridge Road. On Fridays, from 9 a.m. to 4 p.m., a vaccination clinic will be open at the Florissant Valley branch, 195 New Florissant Road, South. And on Saturdays, from 9 a.m. to 4 p.m., a clinic will be operating at the Rock Road branch, 10267 St. Charles Rock Road. Consent forms for those ages 12 to 18 must be completed in order to receive a vaccine. Appointments can be made, but walk-ins are always welcome. And free transportation to the clinic is also available by calling 314-615-2660. To make an appointment or to find a consent form or to find information about the vaccine clinics, please visit our website, revivestl.com. Appointments will be made for the second dose after you get your first dose at each clinic. And booster shots are also available for those who are eligible. Getting more of our community vaccinating is critical in getting us through this pandemic. Now, this week, St. Louis County is expected to reach a milestone. Over 50% of our residents who are eligible to get the shot will be fully vaccinated. While it's great to note, we are not even close to having enough people vaccinated to keep this virus at bay. And we've seen how the Delta variant has spread quickly through the community, sickened thousands of our residents, and strained our hospital systems once again. The expanded partnership with the county library system will provide greater access to the vaccine and help us eliminate the disparities we're seeing in certain zip codes, mostly here in North County. Libraries are more than books. They're a community gathering place, an after-school study space, and a weekend activity with the family. And during the pandemic, the library has stepped up to distribute masks, food, and diapers, and continue to deepen its relationship with communities throughout St. Louis County. The library received more than $5 million of CARES Act funding as part of the county's Digital Equity Initiative. The initiative was created between St. Louis County and the library last year to address digital equity among students and seniors in the St. Louis region. The federal pandemic relief funds were used to purchase more than 6,000 Chromebooks and 10,000 Wi-Fi hotspots, all across St. Louis County to provide access to services and also access for students to the website tutor.com. To date, there have been more than 1,700 tutoring sessions for St. Louis County students. And the funds also made available one-on-one tutoring sessions for students with learning disabilities through the Miriam Learning Center. More than 2,000 hours of services were made available to students through this forum. With the CARES Act funds, the library was also able to purchase 1,500 GrandPad tablets for older adults, which proved to be wildly popular, especially for seniors over the age of 75. For older adults, the combined impact of social isolation, limited access to technology, has been particularly challenging. Many of our homebound residents or those living in senior care facilities have not had the same access to online resources like Zoom, email, or video calling to help them stay in touch. And most don't have internet access. With the GrandPads, built-in data connections were available, including free Wi-Fi with every tablet, so no home internet connection or data contracts were required. Details of these new vaccination clinics at the 4 of the library branches will be made available today at our website, revivestl.com, and on the library's website, slcl.org. With me today is Kristen Sorth, Director of the Library. I'm going to turn this over to Kristen, and then we'll be available to answer questions.
Good morning. Thank you, Dr. Page. We have worked with the Public Health Department throughout the pandemic to distribute masks and other PPE and to offer COVID testing on our parking lots. Earlier this summer, we launched a new partnership with the Public Health Department to offer vaccination clinics at several branches. We are thrilled about this expanded partnership because it will make obtaining a vaccine convenient and accessible to area residents. We are so happy to continue assisting the region. The library is a safe and trusted community resource. Individuals can borrow books from our collection, use our computers or free Wi-Fi, sign up for a library card, and get a vaccine, all in one visit. Thank you.
Thanks, Kristen, and I'd be glad to answer any questions.
County Executive Page,
Yeah.
Can you explain why you believe the ordinance you signed into law mandating either vaccinations or testing for county employees applies to the police department?
Well, I don't know that it does apply to the police department. We'll bring it up to the Board of Police Commissioners and have that conversation. It's certainly a gray area. But we know that police are out in the community a lot, and folks in St. Louis County would expect them to be vaccinated as well. We're very sensitive and aware of the new mandates from the federal government for all employers over 100 to be vaccinated. We're waiting on the OSHA guidelines to be published. We may be a month or two away from that to understand the details of that programming and how it impacts St. Louis County and county government.
Yeah, and to follow up on that point, from talking with the business manager for the St. Louis County Police Union, he said that any gray area could be resolved if the Board of Police Commissioners just pass a resolution saying that the vaccine mandate applies to the police department. Would that just do away with any ambiguity there if that was the route taken?
Yeah, we work very closely in partnership with the Police Commission, and I expect we'll continue to do that with all functions of County Police Department and Public Safety. So we'll continue those conversations. We're in the early stages of implementing our vaccine mandate or weekly testing requirement for St. Louis County employees that will follow along the federal standards that we will see implemented across the country.
And the business manager told me that they oppose a vaccine mandate because some of the members don't want to get vaccinated or tested. What would be your response to some county employees that may not particularly like what's coming down the pipe?
Well, this is a difficult time in the history of our country, very similar to the polio vaccine conversations in the 50s. And we'll get through this stepwise. The current guidance from the federal government is vaccine or testing in St. Louis County, and most employers in our region will follow that vaccine or testing guidance. We understand that there will be some discomfort with that. There will be some opposition across the country and across county government. It's human nature, and it's part of the process.
Dr. Page, we have a couple of questions that were sent in earlier. One from Channel 5. We're 2 weeks removed from Labor Day weekend. There was a spike in cases after July 4th gathering. Is it looking like that's going to happen following the Labor Day holiday?
So the question is about a potential spike in cases after the Labor Day holiday. I spoke to our health department leadership this morning. Our cases remain around 260 a day on average. Our positivity rate remains about 9.5% to 10%. That's pretty steady over the past 2 weeks. The full effect of Labor Day activities probably won't be seen for another week or so, but as it stands now, cases in St. Louis County seem to be holding steady. We believe that's in part because of a vaccination rate around 50% for fully vaccinated among eligible residents, which is higher than just about anywhere in the state, still below the national average. And also the widespread adoption of masking in St. Louis County, which we believe has slowed the spread of the virus down quite a bit and has allowed us to hold relatively steady.
Also, Channel 5 wanted to get your reaction to Pfizer's announcement today on vaccines for those 5 to 11.
Yeah, the question is about the announcement this morning from Pfizer that they believe the vaccine is safe for ages 5 to 11, and we'll be presenting that information to the FDA. And we look forward to the vaccine being available to younger kids. That is a significant portion of our community in St. Louis County where it's not yet available. I've had the opportunity to tour the Pfizer facility. The vaccine's made right here in St. Louis County. It's something we should be proud of. And I'm glad to hear that the vaccine is thought to be safe for kids 5 to 12. We'll wait for the FDA to make the final judgment and approval, and as soon as that happens, St. Louis County Department of Public Health will be part of those vaccinating in St. Louis County, along with the other sources of vaccines. We'll be right there trying to get as many people vaccinated as possible, as quickly as possible.
I don't know if the county has specific quarantine rules for schools. When my kid was quarantined, they did cite the health department. When the vaccine does become available, would the county health department redo the quarantine rules? Or are there already rules in place that if you have a child who's vaccinated, they don't necessarily have to be at home for 10 days if they're exposed?
So the question is about quarantine and schools, what the rules are, where they came from. Those rules are generally CDC guidance. They've been adopted by the state. The county participates in those decisions. They talk to the superintendents on a weekly basis at least, sometimes on a daily basis, to make sure they understand the CDC guidance and that their quarantine rules are proper and safe. But the rules that the schools are using are developed through the state, following the CDC guidance, and developed in conversations with the county health department.
Anything else? Thanks, guys.
All right, thanks.